Hi everyone, I'm Lucia, master student of FRJ. I'm from Brazil and my experience report is about homeopathic treatment and a complementary approach for smoking cessation in a public healthcare program. This project is in partnership with FRJ, UERJ and Policlínica of Duque de Caxias Hospital. In Brazil, there is a national tobacco control program that includes therapies with nicotine path, cognitive behavior approach, and in some hospitals includes the integrative and complementary medicine as aromatherapy or licotherapy, for example. The National Cancer Institute is responsible for the National Tobacco Control Program. These include 4 weekly sections with cognitive behavior approach, and if the person reduces the number of cigarettes during the sections or stops smoking, they receive the nicotine patches. The use of integrative and complementary health projects has demonstrated multiple benefits. The description of this experience report was development at this polyclinic since 2022. It presents the effort to implement homeopathy as complementary approach to support smoking cessation. The integrative approach described in this report involved the introduction of homeopathy as a supportive therapy for individuals engaging in the smoking cessation program. In the general procedure, the homeopathic treatment followed the principles of isotherapy using the patient's own cigarettes brands, being as an individualized treatment. Here I would like to show you a video. This video is about the starting point that was a stock solution obtained by extracting cigarette smoke in the isomaker. The etherotherapeutics were prepared according to the Brazilian Homeopathic Pharmacopoeia 3rd edition, based on Hahnemann method. This medicine was dispensed in 6 CH tablets to the patients on the third meeting. Through the process, participants receive counseling sections and guidance on the use of homeopathic medicines, contributing to a comprehensive patient-centered approach. The practical implementation demonstrated that homeopathic intervention was well accepted by participants. Many report improvements in managed to desire to smoke, emotional regulation, and motivation to quit smoking. There were no reports of adverse effects related to homeopathic treatment. Additionally, the incorporation of homeopathy was perceived by the healthcare team as an important enhancement to the quality of care, fostering a more holistic approach that aligns with the principles of integrative health. Here I would like to show you some results so far. The results were compared to the same period when there was no homeopathic intervention, 2019. The difference between the analyzed periods that was in 2019, the participants used patch for the fourth session onwards, and 2023, the participants started to receive the medication in the third session and did not receive the patch. The medication was out of stock in the public health system, and it was possible to observe that those who received the isotherapeutic reduced the number of cigarettes per day, and the homeopathic contributed for the adherence to the program. And some challenge and results and recommendation. There is strengthening professional training in integrative projects is essential for successful implementation. The need for service regarding the production and dispensing of homeopathic medicine at public primary healthcare units and further studies is necessary. 2, and systematic evaluations. In spite of this, the incorporation of homeopathy could be acted as an effective and safety alternative for pregnant and for patients with cardiovascular disease that is contraindicate the use of nicotine patch or bupropion. And special thanks for our team, and thank you for this opportunity.